Hello, my name is Dr. Lisa Wong. I am a practicing pharmacist and a public health student at Yale University. This summer, I have been working as an intern with the University of Maryland School of Pharmacy, focusing on falls initiatives. One of the initiatives includes this training module that will acquaint you with various healthcare disciplines that aid in fall prevention, particularly in the older adult population. The presentation provides a background on the activities you may assist in for the fall prevention event. The event was created in collaboration with the Maryland Department of Health and Mental Hygiene as part of Falls Prevention Awareness Week. Facts and statistics. In older adults, falls are a major cause of injury. In many cases, a fall is fatal for an older adult. 1/3 of the American population aged 65 and older fall yearly. This attributes to over 800,000 hospitalizations and an estimated 27,000 deaths annually. In addition to the injurious harm patients may sustain, there are financial costs as well. The financial cost associated with falling is expected to reach $67.7 billion in the next 4 years. According to the National Institutes of Health, the majority of falls occur in the home. While this may seem surprising, given the hazards associated with the outdoor environment, it is important to note that the average American spends over 90% of their time indoors. A consequence of the large percentage of time spent indoors is the minimal exposure to sunlight and vitamin D. Vitamin D is required for calcium absorption and healthy bones. Of particular importance to healthcare providers, many patients who have fallen previously tend not to speak of it, and few healthcare providers ask about their patients' history of falling. The CDC has recently published data on the death rate of older adults due to unintentional falls. As indicated on the graph, from 2000 to 2013, the death rate among those 65 and older has steadily increased. The blue dotted line is the death rate for females, and the blue solid line is the rate for males. In terms of gender differences, as demonstrated on the graph, more men have fatal falls. However, more women tend to have non-fatal falls. In terms of risk factors associated with falls, a few modifiable and non-modifiable examples are listed. Modifiable risk factors include environmental hazards. Tripping hazards in the home is a risk factor that can easily be modified. Medical conditions including cardiovascular disease, diabetes, and sensory abnormalities. Gait and balance difficulties attributed to muscle weakness. Polypharmacy and side effects of certain medications may also increase the risk of falls. Other modifiable risk factors include vision and hearing difficulties, which are associated with sensory abnormalities. Feet and shoe issues are associated with peripheral neuropathy due to diabetes. Cigarette use and excessive alcohol intake, defined as greater than 2 drinks per day, are also risk factors. These lifestyle choices affect cognition and increase fall risk. Smoking also affects bone health and is a risk factor for osteoporosis. Using assistive devices, including canes and walkers, improperly may also increase fall risk. Non-modifiable factors include increased age and previous history of falls. The focus of the presentation will be on risk factors that are modifiable, as these can be prevented through patient education and screening. The prevention measures reviewed here will focus on an interdisciplinary approach and are not inclusive of the wide range of fall prevention methods. An important fall prevention measure the healthcare providers often overlook is talking to their patients about falls. While discussing fall prevention methods may seem obvious, it is often neglected in practice. However, there are steps that one can take to start the conversation. First, healthcare providers should ask their older patients if they have fallen recently. Secondly, providers should identify possible risk factors through screenings. For example, balance tests or medication therapy management of high-risk medications are a few types of screenings. Thirdly, patients may be referred to local community programs, including exercise programs to help with balance, gait, and flexibility. Patients should be referred to physical and occupational therapists if needed. Lastly, providers should follow up with their patient afterwards to gauge what actions they took and how effective they were. To facilitate communication, healthcare providers may recommend fall prevention resources to their patients. The CDC provides a wealth of educational resources within the CDC Steady Toolkit. Included are brochures and fact sheets geared for both patients and healthcare providers. An useful resource that you may recommend to patients is the What You Can Do to Prevent Falls brochure. It provides an easy-to-read step guide for older adults on activities they can do to prevent falls. These steps include exercising, getting their medications reviewed, getting annual vision checkups, and safe-proofing their homes. The brochure is a free resource and is accessible through the CDC web link listed. Please review the contents of this brochure prior to the health fair. The web link for the Steady Toolkit, which includes all materials mentioned here, will be provided to you at the end of the presentation. Healthcare providers may also recommend patients complete the Stay Independent brochure in order to check their risks for falling. Patients may fill out the above questionnaire and subsequently have their primary healthcare provider assess their risk. As mentioned earlier, patients rarely speak about their history of falling. This questionnaire is a great way to facilitate communication between patients and providers, particularly in the area of fall prevention. Again, this resource is available through the web link listed. Other modifiable risk factors that may come up in your conversations with patients include hazards in the home that may result in falls. As mentioned earlier, the majority of falls occur inside the home, and many tripping hazards are preventable. Possible tripping hazards include, but are not limited to, loose rugs, cluttered floors, unreachable cabinets, poorly lit areas, wet or slippery floors, and the absence of handrails in key areas. To reduce home hazards, the CDC has provided a checklist of fall prevention safety tips in their Check for Safety brochure. The brochure is a free resource and is accessible through the CDC web link listed. The checklist includes safety steps patients can take to improve their homes, including the removal of tripping hazards, adequately lighting the home, installing handrails in key areas such as the stairs or bathroom, removing loose rugs, using non-slip mats in the tub or shower, and placing everyday items in easy-to-reach locations. Continuing on in terms of modifiable risk factors, improving certain medical conditions is another aspect that helps with fall prevention. Medical conditions, including cardiovascular disease, diabetes, and vision difficulties, can be screened and monitored to prevent falls. For example, monitoring blood pressure to ensure levels are within normal range can reduce the risk of falling due to orthostatic hypotension and dizziness. Proper foot care will decrease the risk of falling due to peripheral neuropathy caused by worsening diabetes. Vision changes, including myopia, is another risk factor for falls and can be easily corrected by screenings. Wearing multifocal glasses while walking, and especially while walking up and down stairs, is particularly dangerous, as they can blur distant objects and alter the vision. During the event, some of you will provide blood pressure screenings for patients and counsel them on signs and symptoms of orthostatic hypotension. Some symptoms include dizziness or lightheadedness, fainting, and blurred vision. In general, the normal blood pressure range is less than 120 over 80 millimeters of mercury. However, the blood pressure goal may be different for different patients, and one patient's baseline may vary from another patient's baseline. Keep in mind that you are treating people, not numbers. Guidelines for target blood pressure levels have varied over the years, and conflicting research has raised many questions and concerns about the ideal blood pressure range. A recent landmark study published in late 2015 by the Sprint Research Group concluded that a target systolic blood pressure of less than 120 millimeters of mercury had lower rates of cardiovascular events and overall death, compared to a target of less than 140 millimeters of mercury. However, there are limitations to the study, including generalizability issues. For example, patients with diabetes, as well as patients with previous history of stroke, were not included in the study. The researchers defined their criterion for increased cardiovascular risk, but failed to include certain risk factors for cardiovascular disease, including diabetes and family history. Another limitation to the study is that participants self-reported their cardiovascular outcomes. Patients may not necessarily report or know of their disease outcomes, and may therefore bias overall results. Additionally, the treatment group experienced statistically significant higher rates of adverse events, including hypotension, electrolyte abnormalities, and acute renal failure that resulted in hospitalization. While some of the adverse events were deemed significant, such as hypotension, injurious fall was not. An important reminder when targeting lower blood pressure levels is to weigh the risk and benefits, especially in older patients. While the study suggests that a systolic blood pressure of lower than 120 millimeters of mercury may decrease the rate of death due to cardiovascular events, achieving this goal may prove expensive and difficult for older patients. It may expose them to adverse events that may result in disability and hospitalization. Additionally, results of this study do not discount current JNC guidelines for target blood pressure rates. Physical activity and involvement with physical therapists are important to both physical and mental health, and alleviate symptoms of various chronic conditions. Some older adults believe the misconception that physical activity may increase their risk for falls. In actuality, it is vital to preventing falls. Ideal workouts for older adults include mild weight-bearing exercises such as walking, tai chi, stepping on, and a matter of balance programs. These exercises improve a variety of factors, including balance, gait, flexibility, strength, mobility, and range of motion. The CDC has created several screening tests that examine physical strength, mobility, and balance. The 30-second chair stand test will be used to screen patients during the health fair. You may be assigned to assist a faculty member in this process. Other tests include the timed up and go or tug test and the 4-stage balance test. Please review the 30-second chair stand test prior to the health fair. Another preventable risk factor for falls is medication use. Polypharmacy and the adverse effects of fall risk increasing drugs, or FRIDs, are all risk factors for falls. Polypharmacy is generally described as the use of unnecessary medications or the use of 6 or more medications. Fall risk increasing drugs include the medication classes listed. They include sedatives, antihypertensives, NSAIDs, opioids, antidepressants, benzodiazepines, and antipsychotic medications. For example, some adverse drug reactions due to these high-risk medications is listed to your right. Antipsychotics, antidepressants, and metoclopramide may precipitate falls by inducing gait abnormalities. Stimulants, antipsychotics, and caffeine may precipitate agitation. Other adverse drug reactions include cognitive and functional decline induced by sedatives, anticholinergics, and benzodiazepines. To reduce polypharmacy and the use of fall risk increasing drugs, healthcare providers can provide medication therapy management services to patients. Pharmacists may identify certain medications that increase fall risk in their patients and recommend alternatives to be prescribed by physicians. This process aims to provide appropriate, safe, and effective medication use while reducing medication misuse. During the fair, you may assist faculty members in providing medication therapy management and assessing patient medications. This process reduces the incidence of polypharmacy and unnecessary medication use, as well as determine any high-risk medications the patient may be on. There are a few steps to keep in mind. Firstly, the faculty member will assess all the medications the patient is taking, including prescription and over-the-counter medicines. He or she will ensure that the medication is appropriate for the indication noted by the patient. Secondly and thirdly, he will weigh the risk of adverse events and benefits of the medication to determine the eligibility for discontinuation. Lastly, the faculty member will prioritize the medications for discontinuation and contact the patient's physician to discuss the discontinuation or suggest alternatives to treatment. At the fair, students assigned to assist in providing medication therapy management will use the anticholinergic risk scale to assess anticholinergic burden. Many of the medications listed on the right are considered high risk, particularly those with higher points. Besides possible discontinuation and non-pharmacologic solutions, safer pharmacologic substitutions may be available. Please review the scale prior to the fair date. The CDC has created a pocket guide for healthcare providers that provides an easy-to-read algorithm that assesses fall risk in patients. For example, the patient fills out the Stay Independent brochure discussed earlier, and if he answers yes to any of the key questions, evaluate his gait and balance with the recommended timed up and go or 30-second chair stand or 4-stage balance test. If there is a balance issue, and depending on the number of falls, the patient is identified as moderate or high risk. With both moderate and high risk patients, fall prevention education and referral to a community fall prevention program is recommended. In low risk patients, fall risk prevention education and vitamin D with or without calcium supplementation may be recommended. Further information regarding this guide may be found on the CDC website. In summary, prior to the health fair, you will be assigned to assist faculty members in providing blood pressure screening, strength and endurance monitoring, or medication therapy management. Each patient requires his or her own specialized consultation. Among patients, there is patient variability, and their goals of care should be specialized to their specific risk factors, such as history of falling, as demonstrated by the SPRINT trial. While assisting, please keep in mind the points discussed earlier regarding each topic, and that there is no one blanket treatment or recommendation plan for all patients. As part of a team, communicating with your colleagues and patients is important. Effective communication is the key to strengthening relationships between you and patients. It builds trust, and patients are more likely to adhere to their treatment plans and recommendations. Overall, it reduces medical errors and improves health outcomes. Some recommendations and examples for effectively communication with your patient are listed. These tips are provided for you to ensure successful communication with your patients. It is important to address the patient properly, using the correct salutation. You should also introduce yourself and explain your role in the process of caring for the patient. It is important to check up on the patient and ask for his or her concerns throughout the screening process. Actively listen to your patient by maintaining eye contact and responding with replies like, "I see," or "Okay." This ensures that the patient feels you have their interests in mind and that he is well taken care of. Other tips to keep in mind while consulting patients is to use simple layman's terms. Avoid using medical terminology patients may not understand. Always speak clearly and slowly to avoid rushing the patient through a conversation. Rushing or interrupting the patient may come off as impolite and disrespectful. It is also important to empathize with your patient. It can encourage him to tell you more about his conditions that may be risk factors for falling. Lastly, ensure your patient understands next steps going forward. The teach-back method is often used, where the patient explains in his own words what needs to be done regarding his health. Now that we have reviewed key facts about the epidemiology of falls and discussed the various methods healthcare providers can decrease the fall risk in older adults, a short quiz will gauge your knowledge and prepare you for the upcoming health fair. At the conclusion of the quiz, you will find web links to various fall prevention resources that you may review prior to the event.